and welcome to our programme Q&A, which will cover the MSc in Global Mental Health and our Masters in Public Health. We've got a full panel here today, which is great. So if we can go round the room and introduce ourselves, and then we'll do a bit of an introduction on both of the programmes, if that's all right. Andy, do you want to kick off? Because you're sat
Yep.
first on my screen.
Yep, no problem. I'm Andy Smith. I'm the administrator of the MSc in Global Mental Health.
Shall I go next? So my name's Julie Langan-Martin. I'm Professor of Psychiatry and I'm the programme lead for the Global Mental Health Masters programme.
I'm Dr. Sharon Greenwood. I run the Masters in Public Health programme on campus, and I'll pass it over to Margaret.
Hi, I'm Margaret Ashton and I'm the administrator for the Master of Public Health.
Perfect. And then Julie, would you like to give us an overview of global mental health?
Yep, that sounds fine. Sharon, are you able to share your screen? Is that okay? And we'll go through. We've got a couple of slides just to highlight the structure of the academic year for both. So this, I suppose, applies to both global mental health and Masters of Public Health students. So if you're a full-time student, you'll start in semester 1, which runs from September till December. And you'll take 3 courses if you're a full-time student. So the way that we organise the teaching is that you have weeks 1 to 5, and then you have a reading week and a catch-up week, and then weeks 7 to 11. And then in semester 2, again, this runs from January to March. Again, if you're full-time, you'll be taking 3 courses during this period. And again, a very similar structure with weeks 1 to 5 of teaching, a reading week or a catch-up week, and then weeks 7 to 11 of the teaching course. And then during semester 3 or the summer term, which runs from April to August, you'll be working pretty much full time on your project during this time. So thinking about the global mental health course as it stands, we have the Global Mental Health Masters Programme, MSc, and we also have the Global Mental Health Masters Programme with a specialism in health promotion. And this just affects the courses that you take, and I'll explain that in the next couple of slides. So thinking about the courses that you'll take in the different semesters, again, if you're full-time, you'll do the core courses, Themes in Global Mental Health and Research Methods in semester 1, and you'll take 1 optional course. And then in semester 2, you'll do your final Mental Health Law and Policy core course, and then you'll have 2 optional courses, and then you'll do that project in the summer term, which is 60 credits. If you choose to do the Global Mental Health Specialism in Health Promotion, you'll do less optional courses because you've got more core courses. So you'll do 3 core courses in semester 1. So you'll do the 2 Themes in Global Mental Health Research Methods that all students will do. And then if you're doing the Health Promotion Specialism, you'll do Cultural, Social and Biological Determinants of Mental Health course. And then in semester 2, in addition to the Law and Policy core course, you'll do the Mental Health Promotion across the lifespan core course, and then you'll have 1 option. The important thing to note is that if you're doing the specialism, you have to make sure that your dissertation aligns to that specialism as well. But that's fairly kind of easy to do, and that's something that will work with you and your supervisor to make sure that your dissertation is aligned. We have lots of optional courses for the Global Mental Health Masters programme. So these are listed here. I'll not run through all of them, but in semester 1, you can take Principles of Public Health, which is part of the MPH programme, or we have the Religions, Cultures and Environmental Crises course, which actually sits in the School of Arts and Humanities. And this is an optional course that's been in place for around about a year now. Semester 2 has, again, a range of optional courses. Some of these courses sit within the Masters of Public Health, things like Globalisation and Public Health, Planetary Health and the Qualitative Research Methods course as well. So there's a wide variety of optional courses that you can take if you're studying the Global Mental Health Masters programme. Great. So shall I hand over to Sharon, who's going to talk about the MPH structure?
Yeah, thanks, Julie. So with the Masters in Public Health on campus, we offer the Masters in Public Health programme just as standard, but we do have 4 specialisms. We offer a specialism in data science, 1 in epidemiology, 1 in health economics, and 1 in health promotion. And similar to what Julie was saying about the global mental health health promotion specialism, there is an associated core course with this, and your project has to align with that particular specialism. So similar to what Julie had said in terms of the general structure, semester 1 for the Masters in Public Health is all core courses. So we do an Introduction to Epidemiology and Statistics, a Research Methods course, and Principles of Public Health, which is all happening in semester 1. In semester 2, if you're doing a standard MPH, you will have 3 optional courses to take. And then you will be doing your project, which is your student-led project over the summer. For those who are doing a specialism, it's exactly the same for semester 1. For semester 2, you will have an associated core course. So for epidemiology, that's advanced epidemiology. For data science, that's real world data. For health promotion, it's health promotion. And for health economics, it's health economics. So it's very, very intuitive. Your project, as well as what Julie was saying for the health promotion with global mental health, your project has to be aligned to the specialism as well, but we do give you guidance on that. And similar to the points that Julie had flagged up, we do have a wide variety of optional courses. Some of the ones that you perhaps didn't see on Julie's slide were things like advanced epidemiology, advanced statistics, communicable diseases, managing healthcare organisations, oral health, and social determinants of health. They're all really, really popular courses. And yeah, that's pretty much the degree structure for me. So I'll stop sharing just now, and then I'll pass it back over to Naomi.
That's great. That was really nice to see it all broken down and how all the different specialisms work. Can you tell us a wee bit about the project? So that's the big 60 credit project at the end. How the sort of process of that works for students? When do they choose their topic? When does all that kind of happen?
Julie, do you want me to go for this? Yeah, so we do a kind of joint process, and we're working more collaboratively across the school. So all the master's programs work together in terms of supervisor allocation. We are moving more towards supervisor-led projects. So in that context, your supervisors will be providing a list of topic ideas, and we'll be asking students to opt in to an idea. We can support students who have their own topic idea, and we can work with them on a one-to-one basis. But what we found is that students do better and they have more success when they are working on a supervisor-led project, or at least something that is loosely set by the supervisor.
Perfect. Julie, is there anything you want to add on to that?
No, I think Sharon's pretty much covered it. We do this kind of process jointly, and we try and do it fairly early on in the academic year. And yeah, as Sharon said, it really is working really well for other students.
Perfect.
And you tend to have your supervisor before Christmas, so you have your supervisor in semester 1.
That's great. And those optional courses that you mentioned, I know it might be different for both programmes, but when are students expected to choose those? Is that when they first start, or do they get a bit of time?
For the MPH, we ask them to choose when they first start. And the reason for that is that a lot of our options are very, very popular. So we want to make sure that you can get access to that. We've also got a lot of programmes that opt into our optional courses. So we want to make sure that you get access to those courses first. So we do recommend, particularly for courses that are really popular, such as communicable diseases or managing healthcare organisations, that you opt in at the start. With your specialism, we also ask that you opt in at the start. You can drop a specialism later on, but because of the associated core course, it can be a bit more difficult, particularly in the Masters in Public Health, to pick up a specialism later on.
Yeah, so I would just kind of echo what Sharon says. So we encourage students to choose their courses fairly early on, especially because we've got an optional course in semester 1. Students are needing to kind of think about that quite carefully. We have an induction week where we're happy to provide more detail about specific courses, send course handbooks and things like this, just so that everybody can make a fully informed decision about which courses that they're wanting to take.
Perfect. And that induction week, details of that will be sort of communicated to you closer to registration. Don't panic, you've not missed any dates. And whereabouts are classes typically held? Are they on main campus, or are they a bit spread out?
So shall I go first, Sharon? Is that okay? Sorry to jump in there, apologies. So in global mental health, for the global mental health courses, we're very fortunate. We have our new Claris Pears building. So the vast majority of our teaching happens on level 1 in the Claris Pears building. We've got pretty new purpose-built teaching space there, and we're very fortunate that we're able to utilise that for the vast majority of our courses for global mental health. for the humanities course that will be taught up on the main campus in some of the the arts and humanities building space, but it's all on the main campus, which is really nice.
And it's a gorgeous new building, isn't it?
It's lovely, it's so nice. And it actually, we've got the benefit of students can actually access some individual study spaces up on level 2 and level 3 of the building, which is something that other programmes and other schools offer across the university don't offer. For the MPH, our semester 1 courses, unfortunately, are, because of our class sizes, aren't taught in the Clarice Pears building, but all of our semester 2 courses are taught in the Clarice Pears building, with the exception of 1 or 2. The oral health course is taught actually in the dental school, and we've got a few distance learning courses that we offer in the second semester. So those are actually courses that you'll be learning with our online Masters in Public Health students and our online other programmes that sit within the school. So those are things like health economics and the real world data course, and you'll be interacting with people from all over the world online.
Oh, fab. And I know it's a really difficult question to answer because it will change from semester to semester and depend on what optional courses, but how often should students expect to be kind of in class on campus, and how many days?
Do you want to go first, Julie?
I can go first. So yeah, I mean, as you said, Naomi, it does vary depending what courses students are taking. But for global mental health, generally our core courses are taught on a Wednesday in semester 1. So students are in kind of all day on a Wednesday in semester 1. There's some of the research methods courses also, or sessions also happen on a Monday afternoon. And then the optional courses can be variable. So some run on a Thursday morning, some run on Friday, for example. So generally, I would say students are probably in, 3 half days a week, probably. And that might be 3 separate half days, or it could be a full day and then a half day, but just depending on the optional courses that they take.
For the Masters in Public Health, it's probably slightly more. In semester 1, all of our teaching tends to happen over Tuesday, Wednesday and Thursday. Tuesday is our Principals Day, Wednesday is our Intro to Epi and Stats Day, and Thursday is our Research Methods Day. The only exception to this is that there will be stats labs for the second half of the Intro to Epi and Stats course that may run on a Friday, and that happens in the kind of second part of semester 1. In semester 2, we've got courses that are taught all throughout the week, and the reason that we have them all throughout the week is to ensure that people get the maximum amount of choice. One course that I actually missed off the list is a new course that's coming up, which is Sexual and Reproductive Health, which I think is going to be an option for your programme as well, Julie. And that is actually doubled up with advanced epidemiology, unfortunately, just because of our timetable. But we're hoping that it'll be accessible for everyone.
Great, exciting, lots of new courses coming on. And can you tell us more about the assessments that students should expect throughout their MSc?
In the Masters in Public Health, we do a wide range of different assessments. So you can expect to do things like group presentations, essays, working with statistical data. We've got some quite creative assessments in semester 2 where students are asked to do a variety of different output tasks. Poster presentations are a big one. One of the big things for our Masters in Public Health on campus is our project actually has an accompanying Masters in Public Health conference that runs in June. And this we invite all of our Masters in Public Health students to attend, and other students who are related to the programme. And students will be delivering part of their assessment for their project presentation at that conference. And the students actually really, really enjoy that. We've got some information about that which we can circulate as well. But yeah, lots and lots of real world types of assessment skills.
Yeah, and global mental health is quite similar. We have a diverse range of assessments. So we've moved away from traditional kind of high stakes. So that's like 100% assessments that's an exam, to smaller assessments that are maybe worth 50% of the course credits, but lots of varied assessment types. So things like designing a poster, creating a podcast, and we've got writing blogs, information sheets, lots of varied assessment types to keep students kind of interested.
That's great. Picks up in people's different skills, I suppose, isn't it? And in terms of preparing for an MSc, is there anything that students can do to really set themselves up for when they start their studies in September?
For the Masters in Public Health, you might want to have a little look at some of the statistical programs that we offer. So we offer our Introduction to Epidemiology and Statistics. You're required to either take R or STATA. So there are resources online, lots and lots and lots of self-taught resources on R. So if you wanted to kind of come prepared and ready to go, probably getting a head start with R is a good benefit for you if you're coming to do the Masters in Public Health. Otherwise, I think just really keeping attuned into everything that's going on in the world. I think the beauty of both of our programs are that they're so contemporary, and public health and global mental health are never out of the news. So being able to reflect on the different situations that are going on around the world will definitely be able to keep you in good stead.
Yep, so similar for global mental health, I think just being aware of kind of what's happening in the world around us. And there was a couple of Lancet series a number of years ago that focused on global mental health. So we'd encourage all students to maybe have a look at them. They should be freely available, open access papers, and that's always a really good starting point just to read around this Lancet series on global mental health.
Perfect. I can see a question there coming through asking about sort of scholarships and stuff. This session's more about the sort of programme sort of content and structure, but the links that I've posted in the chat there for the postgraduate event on the 6th, there will be a scholarship session there, and the various scholarships, there is information about sort of dates of announcement and things on the different web pages on the website. One thing that's sort of coming through there is we do get a lot of international students that come onto both the programs. And how does that work? Are the skills that they're learning on the courses transferable to take them sort of back home? Could you maybe touch on that?
Yeah, absolutely. And I think we've been making a real effort to try and diversify our curriculum and really give lots of different lots of different examples from across the world that people can relate to. Part of, particularly for the Masters in Public Health, part of the beauty of our programme is because we've got such a large cohort, we have students from all over the world. And so our discussions in class are really enlightening. For example, this year alone, we've got students who are from Belize, we've got students who are from the Caribbean, we've got students from Pakistan, who are bringing that real rich public health information into the class. So you're learning from your peers as well as learning from us. You will have a kind of understanding of the UK public health system, but we want you to be able to apply that to international context as well.
Yeah, so very similar for global mental health. Again, although we have a slightly smaller cohort of students, they are very international. So again, students from all over the world, bringing their experience from often their kind of working environments into the classroom, which is really nice. And we have a range of kind of case studies throughout our programme, which focus on different countries throughout the world. It would be impossible to cover everywhere just due to the nature of the programme. But we do have kind of case studies from Sierra Leone, for example, from Bulgaria, from lots of different places across the world, and the skills that we develop are definitely transferable to lots of different settings.
Great. And what about after the MSc? What sort of careers do students go on to do?
So,
Shan. So both of our programs equip you with lots of transferable skills, and those transferable skills kind of equip you to work in various different sectors. A lot of our graduates have gone on to work either in national public health agencies, so things like for the Scottish Government or for Public Health Scotland, and UK-based bodies across the UK, but also we've got international people who've went back to perhaps their home countries, and they've maybe got a really prestigious role within their public health or home organisation. We've got a lot of students who'll then go into kind of third sector and charitable organisations, and people who have maybe synthesised their previous degree experience. So if they come with a background in medicine, for example, and are looking to branch out into seeing what public health is. We've got an alumni from a couple of years ago who is on LinkedIn and who's sharing all of these amazing successes that he's involved in at the moment. But he has went back to his medical training, but he's built in the learning and the skills that he's developed through his public health training. And I think from what he's been presenting and pushing on LinkedIn is that he's really is given him really invaluable skills.
Yeah, absolutely. So very similar for global mental health students, they go on to lots of different careers. Some people will go on and work in academia. So we've got people who are now assistant professors at different institutes all across the world, which is really nice to see. We've had people go on to work for the UN. Some people have gone and joined the WHO for several years. People might go on to further study. So some of our students are really keen to go on and do the doctorate in clinical psychology, for example, and sometimes our students go on and do that. Others are keen to pursue a PhD. So really, really varied. As Sharon says, we try and use LinkedIn to try and kind of keep in touch with our alumni, because it's really amazing to see all the wonderful things that they're doing once they graduate and move on from the university.
Yeah. And there's actually a question that was submitted beforehand for our MPH, and it was how accessible is the programme for people who don't have experience with statistics?
It is accessible. You are going to be assessed on your statistics, but it is possible to have a whole curriculum where you only are looking at your intro to EPI and statistics course. I'm from a qualitative background, I'm from a social science background, and I feel like I could come in and do the masters. We try and make it as accessible as possible, and the people who lead our stats course are very welcoming and are very keen to provide support where necessary. But yeah, please don't worry too much about it. There is help and support, and also as a big flag, and something that perhaps Naomi's linked in the chat, is our student learning and development team. There's a specific maths and stats advice support person. So there are supports within the university that you can access external to the programme.
Perfect. I'm just checking through the chat because it's been quite busy, but I see Julie's been answering quite a lot of them because they are quite specific, which is great. There's a couple of questions that came through sort of specific to applications. So I'm just posting our sort of generic MVLS inquiry email address in there. So if you send an email to that, I'll pick that up and I can speak to the sort of relevant teams. We do only have sort of 7 minutes left. I'm just checking that everything's kind of been covered. One of the things we've not covered is it possible to sort of manage a part-time job alongside the MSc?
So I think with obviously when you're thinking about being an international student, the limit for working a part-time job is 20 hours per week. We certainly would not be advocating that you work longer than that, even if you were allowed to. Doing a full-time programme, particularly a master's programme, is really hard work, and we do expect you to be dedicated to your studies and ensuring that you've got your time to make sure that you're appropriately equipped for class. But many of our students do have part-time jobs, and there are the capabilities of potentially doing part-time jobs at the university. There's lots of exciting initiatives coming up with the internships. And I'm sure that we'll get lots of information about that coming through with all your offer invites and things. But there are lots of ways to get involved and potentially make your study and your work synthesized together.
Absolutely. So I would just agree with that. I mean, I think a lot of students do work, given the climate. We know obviously the kind of challenges that many people are facing. But it's just about being kind of, I suppose, super organised and prioritising your studies and making sure you have time as well for yourself, because you don't want you being completely overwhelmed working and studying all the time and then not looking after yourself. So just making sure you're able to manage all these competing demands.
Yeah, and I'm aware we've not really heard from Andy and Margaret, and I know that you both deal loads with students when they sort of come on the programme, and you're an invaluable resource. So if you've not had any questions answered in this session, do contact the programme administrators using the email address that's on the web pages, because they're brilliant. And they'll help sort of get the answer to your questions. But I suppose in the last sort of 5 minutes, you deal with students all the time. Is there any advice that you would give to students sort of starting out in their MSc, because you must speak to them all the time? So if you get any sort of nuggets of information and advice for them.
So I would just say we actually have a really lovely, vibrant postgraduate community within the school, which I think is lovely. So previously we were across like 10 different sites, the university, the school. So the public health students were kind of up in Lilybank Gardens, and the global mental health students were down at Gartnavel. So there wasn't this opportunity for all the students to meet regularly, be in the one school, the one environment, with the kind of shared study space. So there's lots of opportunities, I think, to meet your peers, work with them. We have within our school, we have an Athena Swan Gold Award, and we have lots of groups that are doing lots of great activities. So our students are really active. I mean, last month, one of our students organised a design workshop in level 1 of the building, and lots of people were able to attend that. We're hoping to hold other events throughout the year. So I would just say embrace every opportunity that you have, if you choose to come here. We have a really lovely, vibrant postgraduate community, and we try and, support them within the school.
I mean, I would just add there to what Julie's saying is engage with all the resources that the university offers. The university offers lots of not just academic resources, but resources that are there to support and help students in their health and well-being. And we would encourage students to engage with all of those, and also to engage with the programme on a more personal level. So if they have any issues, or they're, anything at all that's stopping them fully engaging, is to let us know, because we can offer support. There is lots of support and there are lots of help, and we want to do that. So it's just basically, I would say, engage with all the resources that are available to you.
Great. Sharon, Andy, anything you'd like to add in?
I'll let Andy go because I've spoken a lot.
Nope, I think just what Margaret said, there's lots of resources out there. We also have a student support officer based in the graduate school who can help you with any problems that you might have with your health and well-being in general. But yep, just your program administrator is always a good point of contact for any questions you may have about anything. We can point you in the right direction. So always feel that you can approach us at any time.
And Margaret and Andy are two of the most experienced that you'll meet. So you're in very, very good hands.
And they never judge you if you've got a stupid question, which is always good. Well, I think we've covered
There's no
everything.
such thing as a stupid question.
I think we've covered most of the questions that are there. Again, the ones to do with sort of finance, funding, the event tomorrow is a really good session, because there's we've got finance scholarship, we've got live chats all day and things. So do check out that link that I've posted there, and I'll just share that direct as well for you. But yeah, I think that's a nice sort of place to kick off. So thanks very much to our panel for taking time. I know yous have got such busy diaries, so thanks very much for squeezing us in. And like I said, if you've got any further questions, do pick up with the programme administrators and their details are on the web pages. But thanks again, and we'll hope to see you all in September. Thanks very much. Bye bye.
Hi, everyone.
Thanks. Bye.